Hi, I'm Miriam Evans and I am the pelvic health physiotherapist for the south of Paris, and Linda Van Doorn covers the north of Paris. This video is for anyone who's pregnant, and I hope to give you lots of advice about posture and exercises to prevent your body from experiencing aches and pains as the pregnancy progresses and postures change. Just remember that every person is different, so you might find some of these things useful or not so useful, or you might find them more useful as the pregnancy progresses. So starting off, we'll talk about posture, and this applies to everyone. As you progress through your pregnancy, you'll start to notice that as the bump gets bigger, your centre of gravity changes and your posture starts to change. And what we want to do is avoid too much of a change in posture, because it can create back problems and changes in the way that your muscles work. So in general, thinking about a good posture, starting with your feet, try and think about equal weight bearing so that you're not just standing on one leg. A lot of people stand with on one side of their hip out. Well, it'll just create problems now that you're pregnant. Try and think about feet being shoulder width apart. Your pelvis needs to be in a neutral position. So for a lot of people, when they're pregnant, the bump tends to bring them forward so that their bottom sticks out more. And if you're one of those people, you want to try and think about tucking that tailbone under and bringing the pubic bone up a little bit. It's not through tensing your muscles lots, it's just a simple think of pelvic tilt. Now, when you think about your pelvis, if you imagine your belt line or your top of your trousers like the top of a bucket, and the bucket's full of water and you don't want to spill any of that water. So if you're sticking your bottom out, it's going to spill out the front, and if you're a slumper and you put your hips forward, it's going to spill out the back. If you're standing on one hip, it's going to go out the side. So try and think about even weight on your feet and even pelvis. Think about your shoulders. You want them to be just backwards but relaxed, not up around your ears and not slumped forward either. So backwards and downwards. And then the chin, the head posture tends to come forward as the pregnancy progresses. So try and think about growing as tall as you can, chin tucked in, and think about your ears over your shoulders. And then you're going to apply that posture to all the things that you do in general life. So if you're standing at the sink and you're leaning forward a bit and your bottom's sticking out, tuck your bottom under, find that neutral pelvis, stop that water spilling out of the bucket. When you're walking, try and avoid your hips moving too much as you're walking. So again, keeping that pelvis steady without over tensing your muscles. Going up the stairs, you might want to think about going up one step at a time as the pregnancy progresses. When you're pushing a pram, if you've got a toddler already or another baby, again, avoiding your bottom sticking out, tucking that tailbone under, finding a neutral position. Thinking about cleaning the house, hoovering, mopping, again, try and find that neutral pelvis as you're doing it. What we find with finding a neutral pelvis is that as your pregnancy progresses, your ligaments get loose, they get more lax from the hormone relaxin, which is great for allowing the pelvis to grow as the baby comes out during labour. But in the lead up to labour, you want your pelvis to be as stable as possible. So if you're hoovering with your bottom out, you'll find that it moves a lot more. Or washing the floor, you'll find you get a lot of pelvic movement, and that causes irritability at the joints, it causes muscle ache. And if you can put your pelvis into a good position doing those tasks, then it will reduce the potential of pain. Even things like picking up objects, so try and avoid heavy lifting if you can. If you've got a toddler and you can try and avoid lifting them, great, but I know that's also really hard to avoid. So when you do go to lift them, find that neutral pelvis. You find that as you get the neutral pelvis, your tummy muscles engage and it gives you some stability as you pick them up. Again, think about bending your knees and think about safe lifting. So as well as thinking about your posture, you can start strengthening your abdominal muscles. The abdominal muscles during pregnancy will start to lengthen as the bump grows, and they'll start to weaken as they lengthen. But it's really important to keep them strong because they are a big contributing factor to the stability of your pelvis. You can strengthen your abdominal muscles simply when you're sitting or standing by doing an abdominal brace. So if you get your hands around the bottom of your bump, just below your belly button, and so you're supporting your tummy, and I want you to think about drawing your tummy away from your hands, but with your belly button going backwards towards your spine and not upwards. So it's really tempting to suck in up here And if you're sucking in up here, the pressure goes downwards on the baby and you'll feel quite a fullness in the vagina, or it might cause backache. So we want to avoid this muscle being overworking, and we're just drawing these lower tummy muscles away from your hands. So in a standing position, that looks a bit like that, okay? So we're not sucking in up here, we're just drawing away from the hands, these lower abdominals. And you can hold that for a few seconds. Do a few breaths is quite a good idea, because if you're just holding for a few seconds, you might be holding your breath. But if you take, say, 3 deep breaths while you're tucking that tummy in and then let it go, you can do that several times throughout the day. You can do it when you're standing up, you can do it when you're sitting down. It's a really easy way to activate those muscles. Then the pelvic floor muscle is really important. So not only does the pelvic floor muscle group support your organs above, preventing prolapses, preventing continence problems, it also, a strong pelvic floor can really help with your second stage of labour. And a strong pelvic floor should work also very well in learning how to relax as well. So your pelvic floor exercises are really important to do properly. A lot of people do their pelvic floor, but in a particular position, and if it's always in one position, you're probably only going to strengthen one part of the pelvic floor muscle. And for a lot of people, the back part of the pelvic floor gets overactive rather than it zipping all the way forward to the front. So if you can think, just get my model of the pelvic floor. The pelvic floor muscle group goes from the back, from your tailbone. You can see all of this pink is the pelvic floor, and it comes forward to the pubic bone. It's not just one single muscle. You can see it comes out to the sides, and it's several muscles deep as well. It's not just a thin superficial muscle. Okay, so it's really important to get the whole lot working and zipping it from the back all the way to the front. So if you just imagine that you're stopping yourself passing wind and you feel your anus lifting up, and then feel yourself pulling that muscle forward towards the front as though you're stopping yourself weeing, and you should feel it all the way to the front. If you're not feeling it at the front, then that's something to practice, feeling it zip all the way to the front. Now, to feel that muscle zip from the back all the way to the front, you need to be in a neutral posture with that pelvis, as I said, with a bucket, so you're not spilling your water forwards or backwards, and you can feel it zip all the way from the back to the front. It doesn't matter how long you hold it for, the technique is what's really important. Some people might be able to hold for 10 seconds, other people might only be able to hold for a couple of seconds, and it doesn't matter so long as you can hold it for those couple of seconds all the way to the front and then let go. Make sure you have an adequate rest. So you might need 3 or 4 seconds rest before you try the exercise again. And if you're only holding for 1 or 2 seconds, in a few weeks' time you could build it up to 3 or 4 seconds, and then a few weeks after that build it up again. So you're gradually building it up over a period of time. And don't expect to do it really, really quick or get there straight away. With the pelvic floor, make sure that you can feel it fully relaxing as you let go. Make sure you're breathing while you're doing your exercise and you're not holding your breath. And make sure you're not overbracing your abdominals, particularly these upper abdominals. So it's really easy to squeeze those in as you do your pelvic floor, and actually that causes a dysfunctional pelvic floor. So just breathing in, relaxing your pelvic floor, and then as you breathe out, think about zipping your pelvic floor up from the back, zipping it all the way to the front, and then letting it go as you breathe in. As you breathe out, zip it up from the back all the way to the front, and then breathe in, letting it go. As you breathe out, zip it from the back all the way to the front. So that's a nice way to get the technique right. If you can draw your pelvic floor up as you breathe out, it helps to stop you holding your breath. And then of course you can start keeping it up while you then breathe in and then breathe out again, so you can increase that time. So your pelvic floor exercises you should be looking at doing about 3 times a day. Another exercise that's great for strengthening your abdominals and your pelvic floor, but also stretching out your back muscles and keeping your pelvis moving and stopping it getting stiff, is the pelvic tilt. And again, you can do it in any position. So when you're sitting, try and think about just tilting your pelvis backwards and then forwards without your lumbar spine slumping, so you shouldn't be slipping down. So if you're looking in a mirror, your chest is pretty much going down a little bit, but from a side point of view, your back is staying fairly straight. It's just your pelvis moving, okay? So you slumping down and then coming back up again. As you slump down, feel your lower abdominal muscles draw in, and you can squeeze your pelvic floor in, and then sitting back up again. And this position you can do in sitting. So whenever you get stiff, just start doing some pelvic tilting. Avoid sitting for too long, avoid standing for too long. You want to change your position regularly. You can do this in bed. So if you wake up in the night and you need to turn over, on the position you wake up, do some pelvic tilting. In side lying, then roll onto your back. You can do some pelvic tilting on your back, and then you can roll onto your other side and do some pelvic tilting before you go back to sleep. So it's quite good for relieving aches and pains. It's really good at the end of the day. If you've been in an office job sitting all day, or you've been working really hard up on your feet all day, chances are you're going to get home and feel stiff. And just getting on your back and doing some pelvic tilting or sitting, or whatever position you feel comfortable, is a great way of relieving that before you go to bed, to enable you to have a really good night's sleep. So I have also created a video of pelvic floor and core exercises that you can do as an antenatal routine every day if you want to, or several times a week. And that's on my YouTube channel, and it says Safe Antenatal Exercises video. So have a go at that. It also puts you in good positions for allowing the baby to get into good position for being able to descend when it's time. So just a thing about your posture as well when you're sitting. If you're at a desk job, try and make sure that your hips and your knees are at 90 degrees, that if your elbows are resting on the table, that you're not having to slump to get to that position. So in that good posture we talked about, with your shoulders up and relaxing down and your chin tucked in, your elbows should rest on your desk at 90 degrees without you slumping down. You might want to put a rolled up towel behind your back. So if you get a hand towel, fold it in half, roll it up and put it behind your back when you're at work, in the car as well. So having a support whenever you're sitting helps with your back. Think about when you're in the sofa at night, if you're watching telly, trying to put some pillows behind your back to sit you upright so you're avoiding slumping. It might not have ever affected you before, but with lax ligaments, with the hormone relaxin, it starts to cause more aches and pains. So a few other things to look at is keeping active. So if you were already very active before you got pregnant, then continue, don't stop. Continue what you were doing. Just be mindful of avoiding being so breathless that you can't hold a conversation. So if you're running, you might want to slow your running down so that you can still talk as you run. And as your pregnancy progresses and the ligaments get more lax, you might find that's more difficult to do anyway. If you never did any exercise before, don't start now with intense exercise. You could try just thinking about gentle core exercises, antenatal Pilates or yoga, videos that you can try. So just starting where you were when you started pregnancy, carrying on like that. You can do plenty of walking, but think about your posture when you're walking. If you're walking with that pelvis in a neutral position, you will automatically be strengthening the right core muscles. And you can do fast walking to get yourself a bit more breathless if you need to get your for your cardiovascular system. But just being aware of not making yourself over breathless and avoiding too much high impact exercise, particularly as the pregnancy progresses and your ligaments start to get lax. The other thing to be aware of is avoiding lying on your back too long. So after about 20 weeks, when the bump starts to grow, it can be that when you lie on your back, it puts a bit of pressure on your heart. And the symptoms of that will be breathlessness as soon as you lie down. So if you are finding that you're more breathless lying down on your back, then avoid that position completely. If you're not breathless, then I probably wouldn't advise lying on your back for more than 5 or 10 minutes if you don't have to. And if you can avoid that position altogether, then find other positions to exercise in. Constipation can be a real problem for pregnancy as the hormones change, and it can make the stools harder. But also as the baby gets bigger and puts pressure on the gut, then the stools might move a lot slower around the gut. So just ensure that you're drinking plenty of fluids, that you're eating a healthy diet that includes plenty of fruit and veg and mixed fibres. And in terms of opening your bowels, never strain. A good way of stopping yourself straining is to have your knees elevated when you're on the toilet. So using a child's step on the floor, so that you can put your feet on that to raise your knees up. And then if you lean forward onto your elbows while you're on the toilet, and then relax your tummy, and then just doing some gentle breathing. So long as you're constantly breathing and you're not holding your breath, you're unlikely to strain. And then just having patience. So avoiding constipation is going to help a lot. Then from 34 weeks onwards, you can start preparing the pelvic floor for birth, as well as doing the strengthening we just talked about, is doing some relaxation and stretching. So there's plenty of evidence that talks about perineal massage, reducing tears during labour. And there's lots of videos on YouTube that you can look up about how to do perineal massage. But it's basically stretching and massaging the pelvic floor muscles, particularly the deep posterior side muscles. So you're not on the coccyx, you don't go onto the bone on the coccyx, you come to the side of it. So have a look at doing that. You can do it daily or a few times a week just to maintain the stretch on the pelvic floor. The other thing that we know is that breathing is really related to the pelvic floor. So if you're doing regular deep breaths and breathing exercises, it helps to relax the pelvic floor. And just because you've got a strong pelvic floor, it doesn't mean that it's not overactive. So a lot of people's pelvic floor can be overactive, whether it's weak or strong. So it's completely different to, so don't stop doing your pelvic floor exercises, still do your pelvic floor exercises. But if you can incorporate breathing into your daily habits, then it can make sure that your pelvic floor is relaxed as well. And that's got lots of evidence to show that it reduces trauma at birth as well. So considering hypnobirthing, not just thinking about hypnobirthing for the birth, but thinking about doing your hypnobirthing breathing throughout your pregnancy prepares your body, and it reduces your connective tissue tension, and it reduces that overactivity of that pelvic floor muscle, so that your pelvic floor muscle starts working normally. So you can incorporate your pelvic floor exercises and your breathing together to get the best function of your pelvic floor. The type of people that might have overactive pelvic floor would be people that have stressed a lot. If you're an athlete and you work your body a lot, you release a lot of adrenaline normally. Cortisol can cause an overactive pelvic floor. And someone suffering with chronic pain. So if you've been battling pain for a lot of your life, your pelvic floor might be a little bit overactive. But again, carry on doing breathing exercises, and they're amazing at relaxing not only your mentally, but they help to relax that physical side of the pelvic floor. So thinking about positions for birthing, we talked about the stability of the pelvis. So during pregnancy, while your ligaments are laxing, you want to keep your pelvis as steady as possible with that neutral bucket type pelvis, bucket of water pelvis. And that will reduce the movement of the pelvis and causing irritability, ligament problems, and joint pain and muscle pain. However, during the birth, you want the pelvis to relax and you don't need it to be stable, because you want it to open up to allow the baby to come through. So thinking about positions that allow you to do that. So it might be on all fours that your pelvis can drop. It might be inside lying so that your pelvis can move easily. And you might want to be kneeling, leaning on a ball in front of you, or kneeling and leaning on your partner. You might want to consider a water birth so that your body can move as it needs to during that last phase. And just the positions are just something to consider. You can ask your midwife about it. You can, if you've decided what you want, you can write it in your birth plan. But it's looking at the different options that you've got and being flexible when it comes to the birth. So if after watching this video you're still suffering, you've had a practice at the posture, at the exercises, and you have still got concerns about pelvic girdle pain or any other pain in your body, or the function of your bladder or bowels, then you can get a self-referral form off the Paris Teaching Health Board website if you Google pelvic health. Or you can get referred from your midwife or GP. So don't suffer, come and ask us, and we'll be delighted to give you some advice.